Thanks, Kathy. Hi, everyone. My name is Robin and I'm an arthritis educator. One of our roles, it's a very big role when we're talking with people about their arthritis, is helping them to understand and learn more about managing their pain. It's one of the most common experiences identified. Understanding pain is one of the most important things that you can do to start on your recovery. And if you're in pain, you're not alone. Right now, about 20% of people in the world have pain that has consisted or lasted for longer than 3 months. For everyone in pain, we say that it can just hurt a lot because your brain is wanting to protect you. Let's talk more about pain. Pain's not visible. It can be hard to explain to others. We can't see it. Even when we try and explain about pain, it can be hard for others to understand what you're going through, particularly when you're experiencing pain on an everyday, day-to-day basis. You may feel that your pain's not being taken seriously, and that can have a big impact on your levels of pain, not being understood. So what is pain? Pain is normal. We need it to keep us safe. Pain's protective. But pain depends on your brain's evaluation of danger, which makes pain a very powerful influence on our behaviour. Understanding pain changes pain. If we understand more about the pain experience and what is happening, we can make the best choices to change pain. And understanding pain fits well with a holistic treatment approach to pain recovery. And there's really strong evidence that pain education can decrease our pain ratings. There are 2 concepts that I want to talk about before we move into a bit more about pain, and it will help us to understand pain. The first is the concept of linear patterns that usually give us a clear order of events. The nature of this type of pattern means that something has to be completed before the next step can occur. An example of a linear pattern is the moon, where there's a series of phases that follow. If we think of pain in a linear way, then it comes back to one causative factor or existing pain beliefs, which we can often get stuck on. So each of these beliefs are held together by brain cells or brain activity patterns called neurotags, which exert an influence on the development of pain states. Let's contrast the linear pattern with emergent patterns, which can help us to understand the many interactions of parts that can make up this pattern. Understanding pain as being emergent provides us with new ways to understand interactions between the parts that make up the patterns. Pain is the result of many factors interacting with each other in our brain. So, for example, the flock of birds that we see in this image emerges from their collective activity, just as pain emerges in our consciousness as a pattern from our senses and thoughts. So thinking of pain as emergent alters the framework in which we can understand pain. Pain is made in your brain 100% of the time, and so pain is boss. There's no single pain center in our brain. Pain involves a spread of distributed brain activity that involves many brain areas. So let's think of an international airline map of the flight paths to different cities in the world that crisscross across the world. That's what our brain activity looks like. So pain is a conscious experience that involves many areas of the brain across time. Pain is an output from the brain. It's a conscious driver of behaviour for the purpose of protecting tissues. Let's think of sitting on a hard chair, which I hope you're not, and getting a sore bottom. We may wriggle a bit, get up, walk around, grab a cushion to make the seat nice and soft. So when we experience pain, around 500 areas of the brain light up, including areas responsible for emotions, behaviours, sensory information, such as vision or hearing, memory, touch, high-level thought. This really reinforces the fact that there are many factors that combine together to make and modify pain, not just danger messages from our body tissues. Pain is a conscious driver of behaviour, as I've said. We also have an alarm system that contains sensors that trigger constant messages to our brain. These sensors include sight, hearing, smell, taste, touch, and they're also part of our alarm system. Pain is designed to get you out of trouble. So the brain listens to the messages and weighs them up in the context of the situation and may or may not interpret these messages as pain. The tissue damage stimulates special sensors in our nerves. These sensors send danger signals to our brain. All types of pain experience involve thoughts, feelings, beliefs, emotions, and behaviours which are evaluated. Here are some examples where people who've had serious injury and no pain, which highlights that context plays a part in whether pain is made. So there's soldiers on a battlefield who have been injured or lost a limb and reported feeling no pain or limited pain. What about sports people who've played on to finish the game despite being injured? We also need to talk about the difference between acute pain and chronic pain. So acute pain means harm, it's protective. It's pain that's less than 3 months. It's really useful for our survival. So for example, if we didn't have pain, we wouldn't know to take our hand off that hot fry pan. Experiencing pain, acute pain, leads us to take action. So a broken arm is rested, put in a plaster cast, perhaps there's short-term pain medication that's used over a period of weeks, and the tissues then heal and there's no more pain. It served its purpose and is no longer useful. Let's now look at pain that's been going on for a while. So chronic pain, it relates to time. It's pain that lasts longer than 3 months. Chronic pain also involves the spread of brain activity that involves many areas across time. Chronic pain, though, does not always mean harm. Our brain has become overprotective, and the relationship between pain and what is happening in our tissues is not as straightforward or linear in understanding why there is pain. Chronic pain, therefore, can be less useful. If pain persists more than 3 months, the sensitivity of the tissues that detect changes in our body can increase. If pain persists, we also see changes in the brain too. It's as though the orchestra in our brain has stuck on the pain tune. Pain is complex. Our brain can still produce pain in the absence of any danger messages from our body tissues. You can have pain in a part of your body that no longer exists. You may have heard of phantom limb pain, where someone has lost a limb and experiences pain, itching, or tingling, which worsens if stressed. The feelings in the limb are completely real. Brain imaging studies show that the activity in the same brain areas occur whether you have a limb or not. So again, it reinforces that pain is made in the brain. Pain also relies on context to evaluate. So sensory information from our senses, vision, hearing, touch, as well as memory, reasoning, our emotional processing is evaluated. And the brain also considers the potential consequences of the responses, so pain or no pain. Pain experiments have found that a painful stimulus will hurt more if you're told it's hot rather than cold, or if it's paired with a red light, it will hurt more compared to being paired with a blue light. The point of these examples is to show that there is a variable and changing relationship between unpleasant stimuli and nociceptor activation, which does not convey an accurate indication of the state of our tissues. Importantly, it shows that other factors are involved beyond tissue change and things happening in our body. The context of the pain experience is important. For example, a finger injury is experienced as more painful compared to, say, that of a ballet dancer. Can you think why? It has more importance, the finger, for a violin player compared to anybody else, so the pain levels are going to be evaluated as higher. Another example is when we stub our toe and it hurts. We may rub our toe to stop the pain. However, it is the nerve endings in your toe that send danger messages up to your brain. And this is what is happening when you stub your toe. These danger messages tell the brain where there's too much stretch, it's hot or cold, and stubbing. But it is up to the brain to judge everything else that is going on at the time you stub your toe and decide whether it's a good dose, whether a good dose of pain is what's needed to help you change your behavior. If you stub your toe running across a busy highway, it's unlikely to hurt. But if you were wandering into the kitchen for a midnight snack and you stub your toe on the kitchen chair, it probably will. In this image of the elephant sitting on a person, we can see that the extremely exciting film in the second part of the image is having a positive effect on whether that person is having pain or not. And once again, it reinforces the situation that you're in and what your brain is evaluating is more important. So the film is prioritizing that it's less important to think about the danger of the weighted elephant sitting on you. As I've been talking about, the brain listens to the danger messages and weighs them up in the context of your situation. Danger messages include thoughts, feelings, and behaviors. Now, here are some examples of what we might say to ourselves. Pain means damage. This condition never heals. I have a diagnosis, but I don't really know what it means. We also have protection messages. So thoughts, feelings, and behaviors can also reduce danger messages to our brain. So it is possible to treat pain. Things are looking up. I'm sore, but I'm safe. So also being aware of a scientifically proven path to recovery, understanding your diagnosis, knowing you're not the only person to be in this situation, perhaps making an appointment to see a health professional or a physiotherapist, are all protection messages that can help us reevaluate the safety that we can help to reduce our pain. So what is pain then? Pain is about danger and safety. Pain does not exist when your credible evidence of safety is greater than your credible evidence of danger. So just to summarize, understanding pain fits well with the holistic, multidisciplinary treatment approach, which includes health professionals such as your doctor, pharmacist, physiotherapist, occupational therapist, podiatrist, along with all the self-management strategies that Zoe's going to be talking about, as well as Linda with regards to pain medication. Understanding how we can train our systems helps us to understand and seek answers to promote pain rehabilitation.